Healthcare looks different since the pandemic started. Health professionals are navigating new ways of seeing patients and providing care.
I've been able to do a lot of telehealth visits and catching up with patients that I just hadn't even seen in the real live office.
Before, telemedicine virtually did not exist. I mean, you knew about it and you heard about it, but now, telemedicine is really an option at all the places I work. I think it's another adjunct that we can use to deliver care, and it's been working pretty well.
Telemedicine has drastically expanded throughout the state of Washington.
We had 20,000 telemedicine visits last year. In February, we had about 300. In March, we went up to 14,000. April, we were 30,000. May, we were 33,000. So we had a 100x increase in about 2 months.
The system has many positives.
Sometimes my patients don't know exactly what they're taking. I can say, well, let's go to your medicine cabinet, So they can go to their bathroom and grab the bottles, and they hold them up to me.
But also has some negatives.
In our valley, we still have a lot of families that don't have access to good broadband or good internet.
Before the pandemic, if you had internet access in a rural area, you still might not be approved for telemedicine visits through your insurance.
You had to be in a rural area or a medically underserved area. And just so you know, Yakima does not apply. In fact, only 20% of Washington State was considered to be in one of those designations.
Those policies have relaxed, but it's only temporary.
It literally does take an act of Congress to make changes in Medicare policy.
Professionals see telemedicine as a new staple of healthcare, even though it doesn't cover everything.
There's no way to replace this, right? Talking to someone, looking someone in the eye, listening to their heart, pushing on their leg, right? And so that is not there, and I would hate to lose that, because that's what makes medicine so beautiful.
Jamison Keefover for KVUE Local News.